Today we'll discuss the commonly used terminologies, that is the preload and afterload of the heart. Preload and afterload to the heart. Now what is meant by this preload and afterload? Simply, preload means the end diastolic volume. What is preload? Preload is the end diastolic volume, or we can say it's a volume of blood present in the left ventricle at the end of diastole. What is end diastolic volume? It's a volume or amount of blood present in the left ventricle at the end of diastole or just before the contraction of the left ventricle. What is end diastolic volume or preload? It's a volume of blood present in the left ventricle at the end of diastole or just before the contraction of the left ventricle. For that, we should understand the circulation in the heart, how the blood circulates. That we all know there are four chambers: right atrium, left atrium, right ventricle, left ventricle. Four chambers, and there are four valves also. But before that, we should know from the upper part of the body, that head, neck, face, the deoxygenated blood comes to the right atrium through the superior vena cava, right? Deoxygenated blood from the head, neck, face, or from the upper part of the body comes to the right atrium through the superior vena cava, and from the lower part of the body deoxygenated blood came through the inferior vena cava to the right atrium. Then from the right atrium it goes to the right ventricle. From the right atrium the deoxygenated blood goes to the right ventricle through the valve that is called as tricuspid valve, because there are three layers. From right atrium to the right ventricle there is a tricuspid valve. So deoxygenated blood comes to the right ventricle, and from the right ventricle it goes to the lungs. Why it goes to the lungs? For the purification of the blood. And from the right ventricle there is a pulmonary artery and there is a pulmonary valve. So this deoxygenated blood goes to the pulmonary artery to the lungs for the oxygenation of the blood through this pulmonary valve. Blood will get oxygenized and it will come back to the left atrium through the pulmonary vein. Right? The oxygenated blood come back to the left atrium through the pulmonary vein. Now in the left atrium there is a oxygenated blood. Right? Now this oxygenated blood comes to the left ventricle through the mitral or bicuspid valve. Right? And here the preload, left ventricular or end diastolic volume, means it's a volume or amount of blood present in the left ventricle at the end of diastole or just before the contraction. When the left ventricle contracts, the blood which is present in the left ventricle, where it goes? It goes to the aorta through the aortic valve. From the left ventricle, where it goes to the aorta, right? Through the aortic valve. So what is preload? Preload is the amount of blood present in the left ventricle at the end of diastole or just before the contraction. What is preload? What is preload? It's the amount of blood present in the left ventricle at the end of the diastole or just before the contraction of the left ventricle, and that is called as the preload. Right? Preload is mainly depend upon the venous return to the heart. Whatever venous return to the heart which is came from the superior vena cava, which is came from the inferior vena cava, or from the whole body, that is venous return to the heart. So it is mainly depend upon the venous return to the heart. Preload is mainly depend upon the venous return to the heart. So more the venous return, more is the preload. right? More the venous return to the heart, more is the preload or more is the end diastolic volume. Now drugs which dilates the vein, that we called as a venodilator. Drugs which dilate the veins, we call it as a venodilator. What will happen if there is a venodilatation? It will decrease venous return to the heart. That means it will decrease the preload. It will decrease venous return to the heart. That means it will decrease the end diastolic volume and that will decrease the preload. Right? Now, what are the drugs which decreases the preload? What are the drugs which decreases the preload? Drugs which decreases the preload, we'll see. Drugs which decreases the body fluids like diuretics also decreases venous return to the heart and it will decrease the preload. Right? Drugs which decreases the body fluid like diuretics or nitrates, glyceryl trinitrate, isosorbate dinitrate, these are the venodilators. They primarily decrease the preload, right? Or the drugs which decreases the body fluids like diuretics. Diuretics, they decrease the total body volume. They decrease the total body fluid. So if they decrease the total body volume or total body fluid, they will decrease the venous return. If they decrease the venous return, that means they decrease the end diastolic volume or they decrease the preload. So we'll see venodilatation. There is a venodilatation or dilatation of the veins. So because of the dilatation of the veins, there is a peripheral pulling of the blood from the whole body. There is a peripheral pulling of the blood because there is a venodilatation. If there is a peripheral pulling of the blood, so venous return to the heart is decreased. Venous return to the heart is decreased. Why? There is a peripheral pulling of the blood. Why peripheral pulling? Because there is a venodilatation. If there is decreased venous return to the heart, there is a decreased end diastolic volume. If there is a decreased end diastolic volume, that means it will decrease the preload. If there is a decrease in the preload, that means it will decrease the cardiac workload. If there is a decrease in the cardiac workload, that means decrease oxygen requirement of the myocardium. That means there is a decreased oxygen demand. It will increase the cardiac efficiency. And that's how these nitrates or glyceryl trinitrate, isosorbate dinitrate, all these nitrates, they are useful in angina pectoris. Why they are useful in angina pectoris? Because they decrease the preload. They are venodilators. Predominant action is venodilatation. They decrease the preload. How they decrease the preload? Just we have seen. By venodilatation, there is a peripheral pulling of the blood, and because of peripheral pulling of the blood, it will decrease venous return to the heart. And because it will decrease venous return to the heart, it will decrease the end diastolic volume. It will decrease the preload, and that's why it will decrease the cardiac workload. And because of the decrease in the cardiac workload, it will decrease the oxygen requirement of the myocardium. It will decrease the oxygen demand of the myocardium, and that's how it will increase the cardiac efficiency, and that's how it is beneficial in the angina pectoris or ischemic heart disease. Now we'll see the afterload. What is meant by the afterload of the ventricle? When we say afterload of the ventricle, that means in simple words we can say systolic pressure in the aorta. In simple words, what is meant by the afterload of the ventricle? Afterload of the ventricle is nothing but the systolic pressure in the aorta. Whatever systolic pressure in the aorta is called as afterload. Or we can say peripheral resistance in the systemic circulation or peripheral resistance in the aorta. Or peripheral resistance is the afterload. Right? That what is afterload of the ventricle? It is the systolic pressure in the aorta. We call it as afterload. Or this afterload is also called as the peripheral resistance. Now, what is the peripheral resistance? The peripheral resistance is the resistance offered by arterioles. What is peripheral resistance? It's a resistance offered by the arterioles to the movement of blood from the arterial side to the venous side. There is a shifting of blood from the arterial side to the venous side. So there is a resistance offered by the arterioles to the movement of the blood. Now here you will understand this is the left ventricle. From the left ventricle, blood goes to the main artery, that is the aorta, through the aortic valve. This is the aortic valve. This is the left ventricle. When there is a contraction of the left ventricle, blood goes goes to the aorta through the aortic valve. Now the pressure which exerted by the blood on the walls of the aorta, that is nothing but the afterload. What is the afterload? Afterload is nothing but the systolic pressure in the aorta. Systolic pressure in the aorta, that is called as the afterload. Now what is peripheral resistance? Is the resistance offered by the arterioles. These are nothing but the arterioles. These are the resistance offered by the arterioles to the movement of blood from the arterial side to the venous side. This is the arterial side, this is the venous side. It is blue in color and this is the red in color. So resistance offered by the arterioles to the movement of blood from the arterial side to the venous side. This is the artery, means aorta. They are divided into the arterioles. Then there is these are the venules, this is the vein. So basically this is the arteriovenous tree. So the pressure which is present in the aorta, our systemic pressure in the aorta, we call it as the afterload. Afterload mainly depend upon the arterioles. So predominant arteriolar dilatation, it will decrease the peripheral resistance and it will decrease the afterload. If there is a arterial dilatation, there will decrease in the peripheral resistance and it will decrease the afterload. Now drugs which decreases afterload predominantly, like hydralazine, it's a vasodilator, but predominant arterial dilatation like hydralazine, minoxidil, calcium channel blocker like nifedipine, nicorandil, diazoxide, all these are the predominant arterial dilatation. It will decrease the peripheral resistance, it will decrease the afterload. If it decreases the peripheral resistance, it will decrease the afterload. What happens after decreasing afterload? It will decrease the cardiac workload, it will decrease the oxygen requirement of the myocardium, and it will decrease the oxygen demand, and it will increase the cardiac efficiency. And that's why these drugs can be used in the angina also. But mostly these are the predominant arterial dilatation, so that we can use these drugs as a vasodilators like hydralazine, minoxidil, calcium channel blocker, nicorandil. It is a potassium channel opener which is used in the angina, diazoxide. All these are the vasodilators which predominantly dilate the arterioles. So this is how we explain the terminologies like preload and afterload, right?